Hi everyone, it's Gareth here, part of the teaching and assistant team at P-DTR UK, and I wanted to do a little video about sort of my own experiences and how things have worked for me and changed over time. I graduated as an osteopath in 2014 after doing around 4 or 5 years worth of full-time training, and came out of that with the typical conventional treatment methods: mobilisation, manipulation and soft tissue work. Treating, doing well, and most patients doing well, but there was this percentage of people that things just kept reoccurring, and I really felt like I wasn't getting to the bottom of perhaps why that person was coming in with the problem they had. Through P-DTR, what it's given me is a really good understanding of one main thing, which is this a problem or is this a compensation? And being able to map out things in someone's body and to be able to say, okay, well, I can see that we have a problem here, but I can also see that this is actually compensating for this. And when we take this away, this no longer needs to be there at all. So it really can streamline our process so that we have to actually do much less to create a really good effect. Because if we find the thing that's right at the top, the kind of top priority problem, then that will have some trickle down effect and treat lots of other things without us needing to touch it, which is great. And it also means that I actually don't do much structural work anymore, and the same goes for Steve as well. Very little soft tissue, if at all, well, none really, or manipulation, because really we don't need to anymore. If we find the reason why that muscle is tight, which is simply because the brain and the nervous system is signalling to that area to lock up, if we can find out why that is and change that, then there's no need for it to do that in the first place. It doesn't matter how much massage or soft tissue work we give it, it's always going to lock up again if the brain A doesn't think that it's safe, or B is just trying to protect. So if we can correct the afferent input, the input coming up to the brain from these sensory receptors, then the brain doesn't see that there's any threat anymore, and there's no need to create these joint restrictions and increases in muscle tone. So that basically means that we have to do less. We have to think more, but we definitely do less, which is a really nice place to be, and for you to be able to understand why people feel the way they do, why certain things work and why certain things don't work. And it really gives you this lens through which to see, okay, why is this happening? But overall, very little manual therapy work now, just because there's no need. So I hope that helps, and if there's any questions or anything that you've thought of during this video, then comment below or send us a private message, and we'll be more than happy to answer it. And I really hope that, if you are coming on the P-DTR course with us this September, you can go through a similar process, which I'm really sure that you will, and you'll find it absolutely fascinating, as I did. So great, thanks for watching, and you'll probably see us again soon. Thanks.